you're ready,
Okay.
you want to make sure that you never turn your back on a sterile field. Ever. So you're going to set up what you need here. And then you're going to bring it over here when you're getting ready to do it. There's something in here that's making me itchy. Are
Me
those gloves
too.
latex?
That's why I'm like, what's going on?
They're latex.
You're allergic like that?
Yep.
Oh gosh.
That's okay.
Yeah, when you took them off, your hand looked red. I'm like,
They will be. That's okay. So when you're getting ready, when you open up your sterile kit, like Sarah had said, you're going to come up with your own way of doing it. But I like the way she does it, where you use this as
The garbage bag.
the garbage bag.
Yeah.
So once you go in here and you pull this out, if this is ever ripped like this, don't use it.
Ripped like what? Oh, the paper. Cause then is it not sterile?
It's not sterile.
Okay. Cause it's not able to cover the
Right.
inside completely.
And you're not going to protect the table.
Okay.
But this is my garbage, and I'll always put it down here by my patient's feet, because this is where I'm going to clean.
Should you, like she in the video, she like rolled it over so it will stay open. Is that a good idea too? Okay.
So when you're getting ready to open, you always want to pull away from yourself, like we said before. These little corner tabs that you'll see, there's these little, and I know I'm ruining the sterile field, but what I want to show you is you see how there's little tabs like this on all of them? That's the part that you touch.
Okay.
In some kits, depending on what kit it is, you'll see that there's a cloth that's here. You can use that, you cannot use that.
too.
I don't use it in the beginning.
mind. Oh, yeah.
But these are your hand cleaning, and this comes in almost every single kit that you get, especially in a hospital setting. So you washed your hands, but now you're touching the kit. Before you even finish opening your kit, you're going to open this up and wash your hands. It's just jelly like you would for hand sanitizer. And then when you're done, wash your hands. And these are called Castile. And what this is this just to give it like a wipe down.
Like when you do a clean cut urine.
And there's 3. When you're getting ready to clean someone, you want to go away from you first, next to you second, and then in the middle last. Because in the middle is where the urethra is that you need to find. And then when you're done, you have to get rid of them. Now you can open up the rest of your kit. In here, as you can see, there's already gloves. This is where you have to be careful with your gloves, because you don't want to touch anything on your field. So again, never turn your back on your field. And sterile. You just get rid of it. Now you're getting ready, and inside your kit, you're going to want to look to see what's inside your kit. Most kits, you will have something like this. Some people use them, some don't. You can see how there's a shiny side and a non-shiny side. You want to put the shiny side down toward the patient, and you want to take this.
You okay?
And you want to get it fixed right here, because this is sterile.
I wouldn't be able to touch this.
Nope.
So where would I touch as a support
You're-
person?
The actual labia.
Also inside here.
Yep, you would be my labia support.
Okay.
Once you have your kit, you're going to look at your kit and you're going to see what's in it, because you're like, now I have to get ready to put this in my patient. So there's usually povidone swabs, the water that you're going to use to fill up the balloon, and then you have your KY jelly or your lubricating jelly, and again, this is all sterile. Then you have your kit here, and you'll see when you take your kit out, this is the part of the catheter that goes in the patient, so you want to leave this where it is until you're getting ready to use it. So what you want to do first is, again, you have a partner who's saying, hey, I need some labial support. So it's nice to have a partner that's in here. In reality, guys, you're not going to have a person who's going to be able to help you. You're going to be doing it yourself. So you have a patient.
So can you please do it how you will do it by yourself?
Yeah, all right, Tara, move your hand.
Thank you. Professor Lynn said now you don't have to like check the catheters.
We don't ever check the balloons. Yep, because there's a possibility that you're going to put it in What we used to do is we would take it and we would squeeze some water in to make sure the balloon works, and now it's been proven that a little bit of water still stays in the balloon, and then you're putting this into someone's urethra. It's actually causing friction against it because you're going against that cilia that's there.
So you put the jelly in the side tray.
Yep, I got the jelly in the side tray. I don't need a cup for a sterile sample unless the doctor's ordered one. If they ordered one, I have one right there. Jelly's there. It's at this point you want to be careful because your catheter can like ricochet at you. So again, this is where you need to be careful pulling it out. And you're just going to take it and you're going to let it kind of sit in the lube. Because you want as much lube as possible for this poor patient because you are going into an area that's usually an exit only. At this point, you're going to open up your swabs, and I'm really not going to use them on the patient because I will destroy them if I use it on the patient. But you want to be careful because this is povidone. Once this gets on your scrubs, it's never coming out.
Oh, Nurse Sarah had the cotton balls, but this is already done.
These
for
are
you.
really like how hospital setting is.
Oh, okay.
So again, this is sterile. You can. What's going to happen at this point, though, is I really need to work in her genitalia. So at this point, I would take what I need carefully, and I would move it here. Because now I have everything that I need here. I really don't like this rip screen, but. Now at this point, if I was doing it myself, this hand's not going to be sterile anymore. This hand is, because I'm going to take it and I'm going to open up her vulva to be able to expose it. I'm going to take one and do the outside from the clitoral hood, or actually above the clitoral hood, all the way down, away. So I would do one here, closest to me, and then right in the middle, what Dr. Willie or Professor Willie said is take that last one and just leave it in the vagina, because then you know that hole is there. At this point, you're going to take the catheter, and I always tell my patients, and I found it worked great, is I will always say, take a deep breath, let it out, and as they let the air out, I'm going to insert the catheter into their bladder. The moment I start to get to see urine in the tube here, on a female, you want to go about 1 inch to 1.5 inches more up. For a male, you want to go about 2 inches more, because remember their urethra is longer than a female's. At this point, you want to be careful. You want to make sure that you hold on to the catheter. So now I've inserted it. You want to hold on to the catheter, because if not, because it's an exit only, that catheter is going to start to slip out. At this point, you're going to take your fluid. You're going to fill up all 10 mLs of the balloon, and then what people tend to do, because they don't realize, is you're filling it up. Once you have it filled up, you want to come over here and you want to hold this, and you want to undo it from here. If you don't undo it from there, the water is going to go back into this filter. So watch what will happen. I don't know if it'll happen directly on this patient, but look what happens. And then you don't have the full 10 mLs in there. So you have to make sure that you hold it, put all the fluid in, and it's good to go. At this point, what you want to say to the patient is, some people will say to pull it just a little. I ask the patient to bear down, because that makes that balloon sit very gently on that inner bladder sphincter muscle than actually pulling on it, which means you can cause a bladder spasm. I know you guys know that I have a fear of bladder spasms. At that point, you still want to hold on to the gloves that you have. And you always want to make sure that when you're hanging up the Foley, that you hang up the Foley over the patient's legs and not under their leg, because they can get a sore under their leg. So you want to make sure that you hang it on a part of the bed that doesn't move. So a lot of the beds here, which this one does not, there's usually hooks here. And we'd hang it to a hook, never attach it to a side round. Now at this point, your catheter's in. I don't want to do this, but I usually rip this part off, get everything cleaned up, take off my gloves. Now I need a clean pair of gloves, because now I'm going to attach the Foley catheter to the patient's leg, because you don't want this just dangling. She moves, and again, that bulb with the 10 mLs of fluid in it It's gonna pull. I've actually had patients who are confused that would pull on their catheter and have pulled it out with a 10 ml balloon intact. So you wanna make sure you attach it.
Would that be sterile gloves or just regular gloves?
Just regular gloves, because the sterile procedure's over. This is the kit that we have here. It comes with skin prep, and this is like a real hospital one. It comes with skin prep, 2 of them. I usually ever use 1. You want to open this up like an alcohol pad. This will be off, but I don't want to rip it because it's Professor Lily's. So we'll pretend this is down there. And you want to see where you can attach this to the patient's leg where it's not a lot of tension, that there's some mobility to it. You would take the skin prep and you would just do their leg like that and give it a chance to dry. While it's getting ready to dry, you want to look at this here and you want to say, oh look, see how it fits in? There's like a larger side and a smaller side. You want to take it and you want to put it like that, and you want to close it before you put it on the patient's leg. If not, you're snapping it on their leg and you're pushing on their leg. If they're on a blood thinner, you're going to cause them to get a bruise. At this point, you're going to pull off this end, which again, I don't want to do to the dummy. You're going to pull off this end and put this down here. And then you're going to pull off that end. It's like putting on a Band-Aid. And you want to make sure it goes on their leg like that. When you're getting ready to remove these, you have to use a lot of alcohol to get them off, because there's 2 flies in here. Because you've used the skin prep to put it on, you have to remove this with alcohol. A lot of people will go in with like 10 to 12 alcohol pads. Just use a hand sanitizer, it's all alcohol. When you're getting ready to remove it, and it just makes life easier. You don't have all those alcohol pads where you're trying to. This has to be pulled off very slowly, because you will pull off the patient's skin because you used a skin prep. When it's all done, again, this is already hanging on the side. Usually as nurses, we document how much urine came out immediately. And then after that, depending on what the orders are, is it every 4 hours they want urinary output? Is it every hour they want urinary output? Is it every 8 hours or every shift? And then you'll be in charge of INOs. When you're getting ready to remove a catheter, the same thing. We usually disconnect it from here first, because we kind of leave this on till later to pull off. You only need clean gloves to be able to remove a Foley catheter. So you would bring in a sterile 10 ml empty syringe. And like I said before, this is your point. You have gloves on. What you want to do before you do anything is you want to make sure you are holding this, because as you can tell, you don't need to pull back on the fluid. It just comes back at you. But you want to hold on it, because once the fluid starts to leave that 10 ml balloon, what will happen is, as the balloon gets smaller and smaller, it'll start coming out like this. And if it's not completely empty, we're going to cause shearing to that urethra again. So once it comes all back like this, you want to give it a little bit more of a pull. Again, you want to make sure you have on clean gloves. You don't need sterile gloves for it. Once again, tell the patient, take a deep breath. As you're taking a deep breath, you've got gloves on. Take a deep breath in, let the air out. And you want to be careful to not splash yourself. And then you put this whole thing in your glove when you're done. And you get rid of it.